The last program before we have a brief break. And this is a program on sexual assault nurse examiners program in the city of Tulsa. Kathy Bell and Helen Marie Zakritz.
Thank you. We would like to tell you the story of Tulsa's sexual assault nurse examiners program through the eyes of a rape victim. The victim's name is Penny. She is 34 years old, and she could be your daughter, mother, sister, friend, or neighbor. Penny was returning to Tulsa last January after spending the holidays with her family. On her way home from the airport, two men in a car spotted her, followed her and rammed her car until it was forced off the road. Then they abducted Penny. She was robbed and repeatedly raped, vaginally, anally, and orally by these two men. Later, they picked up a third man and went to a motel where he too raped her. Two of the assailants insisted on food and money. Penny was forced to direct them to her home, where she fixed sandwiches and wrote them 2 checks, which she told them that they could cash at a nearby convenience store. They wanted her to call the store to authorize cashing these checks. Instead, she dialed the operator and left the phone off the hook to allow their conversation to be overheard. The operator determined something was wrong and called the police. Tulsa is fortunate to have enhanced 911. When Penny heard the police at her house, she ran out. When she arrived at the hospital, she was numb and disoriented after her 10-hour ordeal.
Before Tulsa had a SANE program, Penny would have been taken by police to one of 4 Tulsa hospital emergency rooms, where she would have been made to wait up to 12 hours in a public setting with a police officer until more pressing and urgent medical emergencies were taken care of. While she waited, she would not be able to drink anything, shower, change her clothes, or go to the bathroom.
Because we have SANE, Penny was taken to a private suite of rooms at Hillcrest Medical Center designated and equipped only for rape exams.
In the past, the emergency room physician was reluctant to perform this exam because of the time involved and the possibility that later he would be required to testify in court, which would necessitate even more time away from his practice.
Instead, in the SANE room at Hillcrest Medical Center, she was met by a highly trained sexual assault nurse examiner who was dispatched immediately to meet Penny there.
Prior to the SANE program, doctors were trained on a hit-or-miss basis. The quality of the forensic evidence was not consistently good.
Registered nurses are now trained in a course prepared and presented by physicians, police, prosecutors, rape crisis personnel, and sexual assault nurse examiners, followed by clinical training. The Tulsa Police Department Laboratory reports a vast improvement in the quality of evidence collected since the nurses started performing the rape exams.
The step-by-step evidence collection process is quite invasive. In the earlier setting, the emergency department nurse would perform one part of the exam and the physician would perform the other, which required the victim to repeat her story over and over. Often it was necessary to collect her clothing and shoes as evidence, and the victim went home clad only in a hospital gown.
The entire exam is now done by a registered nurse. Many times the victim's clothing and shoes are taken as evidence, but there is a closet equipped with new clothing now to wear home.
The victim of the past would have been billed $300 to $600.
Penny was never admitted as a patient, although the emergency department was near at hand in case she needed treatment, so she was never billed for the examination and medications received. With the SANE program, the total cost is $150 and is paid by the Crime Victims Compensation Fund.
In the past, the responding police officer would be delayed from returning to the field. He could not leave the victim until the exam was completed, and he had the rape exam kit in hand to preserve the chain of evidence, which is so important for the successful prosecution of rapists.
Now the police officer waits in an area specifically set up to prepare his report while the exam is done. The amount of time he has to wait has decreased from 12 hours to 2 to 3 hours.
Although rape crisis advocates were dispatched to provide emotional support to victims, this was nearly impossible due to the chaotic setting of the emergency department. Many times the victim simply gave up and walked away.
A rape crisis advocate is now part of the team that was dispatched to meet Penny in the SANE room. The support provided by a rape crisis counselor immediately following this traumatic experience helped Penny regain a sense of control in a situation where she had absolutely no control.
Penny is one of about 250 rape victims who are examined each year in Tulsa alone. Nationally, there are 683,000 victims each year who we believe could benefit from a program such as ours. Using Tulsa as a model, one other Oklahoma city has started the same program. Several other cities have programs in the development phase. By treating victims immediately, compassionately, and privately, even more victims will report and prosecute their offenders.
In closing, we would like to tell you that 2 of Penny's assailants were apprehended immediately and later tried and convicted of rape and other crimes. Their sentences totaled 6,475 years each. The 3rd assailant is still at large but has been identified. DNA testing is being done in an effort to successfully prosecute him. Thank you.
Thank you. Let's start the questioning from Hubert.
10 years ago, police departments across the country introduced programs to reduce the cold and callous effects of the bureaucracy on rape victims, since it tended to dissuade women from reporting these types of offenses. Many of them worked in conjunction with the prosecutor's office and hospitals, and these programs are in existence in many states across the country now. How would you differentiate the program in Tulsa so that it would in fact be something as a national innovation as opposed to a new innovation in the state of Oklahoma?
We are, as far as I know, the only program of this kind that is situated actually in a police department. In other words, my position is within the Tulsa Police Department with the Sex Crimes Unit. We are also the only program in the country that I know of that is not situated in either a hospital emergency room or in a freestanding clinic setting that does rape exams both on children and adults.
Well, outside of the, you're actually physically located in the police department.
My position is the
You work for the
coordination, the
police
program,
department.
yes, is in the police department.
And there was one other point there with your program. Malpractice insurance is provided. This is related to the City Department of Health.
Right. Well, we are a collaborative effort. I think that's one of the unique aspects of our program as well, in that we do have 7 different entities, including the City County Health Department, that is involved in covering our nurses in malpractice insurance. OU Medical College trains our nurses with the medical component of the training, and the District Attorney's Office and so on are all part of the program, and really it couldn't exist without all of these entities collaborating in an effort to make it better for rape victims in Tulsa.
We have 3 questions pending, Dot and Max and Jack.
Mine really probably is an extension of what you was asking, because I want to make sure I absolutely understand this, because I want to congratulate you first of all, because it sounds like you had a horrible combination of circumstances that made it a very, very bad situation. And I know we all recognize that elements of this are in place a lot of places. So I want to make it absolutely clear, it's really the combination that makes this unusual for Tulsa.
Right. That's right.
All right, but as far as you know, the 2 things that distinguish it from other programs that are not replicated elsewhere, first of all, your position location,
Right.
Which lends an emphasis to it that others doesn't.
Right. And
then the other one, I'm not sure we're 100% certain about this, and it's just that it's not in a hospital emergency room or a clinic setting.
Right.
Which in some places has not been as bad a problem as what you described.
That's right. But I think in major cities, it is a big problem with emergency rooms more and more becoming the first, step for people to go in for medical care. And in fact, in Oklahoma, it's very problematic because in many of our communities, there's only one hospital, especially in the rural areas, where if a police officer walks in with a woman, everybody knows in that hospital what has happened.
Right.
And so by taking it away from the emergency room and putting it in a very private setting,